Were all four of you consulted on this excise tax before the government made these changes in budget 2018? And if so, what was their response to your concerns that I'm sure you surely raised with them?
We were consulted, Canadians for Fair Access to Medical Marijuana Finance, and we also reached out to members across all parties, senators, as well as different bureaucrats in different departments. With that said, I think the consultation was not as effective as we'd like to see, in the sense that the overwhelming submissions that were given, the vast majority from our understanding, were in support of eliminating tax on medical cannabis. As I mentioned, a coalition of very large, credible, respectable organizations, including the Arthritis Society, the Canadian Pharmacists Association, and the Canadian Nurses Association, have put forward a submission as part of that consultation process. But we don't feel like the government is adequately listening. There was a small step to exempt low THC oils, but that is a tiny percent of the market. It shows a complete misunderstanding for what patients are using it, and beyond that, it's not a decision that's based in evidence. The evidence shows, as James mentioned, a very strong, conclusive evidence for the treatment of chronic pain in adults, MS spasticity, and chemotherapy-induced, nausea and vomiting induced from chemotherapy. That's for THC, and that is subject to excise tax.
Now, the Parliamentary Budget Officer released a report on this tax, which notes that the cannabis tax won't raise much revenue because even a fairly modest tax would enable the black market to continue, and the government wouldn't get any of the revenue. Do any of you have any comment on that? And it would seem the government is suggesting that it will raise revenue on the backs of those who are actually struggling to pay for it, for access to medical marijuana, while completely ignoring the fact that it may not raise as much revenue to begin with.
So I would absolutely agree in the sense that this excise tax is using patients to build this new legalized program. Patients have already been suffering with the continued application of GST, HST. That's a situation that means that 6 out of 10 Canadians who use cannabis for medical purposes can't afford their full dose. That number is unfathomable. This government is considering pharmacare because 1 in 10 Canadians can't afford prescription medications, and then they go around and apply an excise tax to medical cannabis when 6 in 10 Canadians can't afford a dose. That makes no sense.
Thank you, Mr. Chair, and thank you to all the presenters. Some very good discussion here today, and I'm certainly learning a few things. I represent the Northwest Territories, and regarding freight costs, I wanted to say we run our alcohol distribution through a liquor commission in Northwest Territories, and the cannabis is going to be run through the same commission. And we already have a lot of controversy over subsidizing the price of alcohol. When we have alcohol landing in a far north community and it's cheaper than what it is in the south, we have a lot of people raising eyebrows. And I think we're going to have the same problem when it comes to cannabis. But I don't have the same concern when it comes to medical marijuana, because I know the benefits of the use of medical marijuana. I got a couple of questions. First of all, I understand the tax issue. We're looking at not having any sort of tax, no GST, no HST. We'll treat this as a prescription drug rather than an over-the-counter drug, right? I'm assuming that's where we're going with this. So that's my first question, if you could respond to that. And the second question, I want your opinion on the conference that was held in Toronto at the end of the month, at the end of April, where physicians talked about they had the discussion on if marijuana should be, if it becomes legal for all, should doctors continue to prescribe it? And if they didn't do that, what would be some of the fallout of that? And there's a number of you that focus on, maybe I can get Anne to respond, and the Canadians for Fair Access and the Cannabis Canada to talk about the issues.
Who wants to start? Canadians for Fair Access?
Sure. So on the first question of prescription versus the over-the-counter, in Bill C-45, it proposes for the medical cannabis system as it stands today as described by Cannabis Canada and Hydropothecary, to continue as is, largely moving into legalization. This will mean a distinct medical cannabis system from non-medical, where patients still have to go to their healthcare provider. They still have to go through that assessment to ensure that they are suitable for the use of medical cannabis and there's no risks in doing so. And then they get their products shipped directly to their homes. This is a distinct medical cannabis program that largely operates what I consider to be similar to an online pharmacy, where it's still a prescription-like document that's sent and used for medical purposes only, and that will be totally distinct. So this is what we're saying should be exempt from taxation. When it's used for medical purposes on the basis of a healthcare provider's authorization, it should be treated like every other medicine that is based on a doctor's authorization, and they are all exempt from tax. On the second question you had, this, I believe you're referencing the CCIC conference. I was a speaker there, so I attended this as well. CFAMM has been advocating for a distinct medical cannabis system for the reasons we highlighted today. Patients have unique needs. It's, I think, irresponsible to suggest that patients, some of who have serious medical conditions like MS, like cancer, to go and simply self-medicate through a recreational cannabis store. That makes no sense. That's not a safe way for someone to integrate cannabis into their health plan, especially when they have other medications they're using. I would also note that over 11 or 12,000 Canadian physicians have currently authorized cannabis for medical purposes. The number keeps going up, so I just haven't seen the latest market data the past month, but this is a number that's growing month over month significantly. So I hear the CMA's concerns, but with that said, patients are very clear, the courts have been very clear, and every other or most other associations that represent different health authorities, such as nurses and pharmacists, have recommended a distinct medical cannabis system.
Another question, perhaps, I think CFAMM commented on it, the question of double taxation. I think beer producers are probably will be facing the same situation. Once excise taxes are paid, you mentioned they're 47% of beer prices. There will also be sales, GST, HST, sales tax on top of these excise taxes. Is this an obstacle to cannabis access?
Absolutely. So today already 60% of medical cannabis patients can't afford their medicine because it's not covered by insurers, but it's also applied a very unfair HST, GST, which no other medications that have to have an authorization by a doctor are subject to. With that said, this new excise tax will be applied at the point of production, so the HST will be compounded. So it would be a double taxation, a compounded taxation on a medicine. So I think that's the really key thing, that patients, people who are suffering from extremely difficult situations, lots of the people we represent are on disability, they have no income and they're already suffering. So going forward and taxing them more is just going to make that suffering worse.
Let's go back to the question of insurance and the DIN, the drug identification number. In your experience, do you think it's absolutely necessary for an insurance company to reimburse the cost of a medication? In other jurisdictions, I think you mentioned Belgium or another jurisdiction, I didn't write it down, Germany. In Germany, insurance does cover the cost of medical cannabis. In Germany, it is medical cannabis an authorized medicine, authorized by their drug authority?
From my understanding, in Germany, it's not an authorized medication through their normal pathways. Medical cannabis is available through pharmacies on the basis of a doctor's prescription, and it is mandated to be covered for those who are on disability or welfare programs. So they do go a step further. With that said, a number of Canadian insurers have moved forward of covering medical cannabis, but with with that in mind, it represents around 3 or 4% of the market who have any coverage, and only 50% of those 3 or 4% have coverage beyond 50% of their dosage. So really, we're talking about a tiny fraction of the market that has any coverage. Mainly, this is attributed to what's known as health spending accounts and benefits plans that allow for medical cannabis to be claimed, but typically only are capped at about $500 to $2,000 a year, which doesn't nearly represent a full dose that someone who has a chronic condition would need. So insurers can cover the costs. There's a number of reasons why they're not. But in that reality, I think it's even more prudent for the government to look at this issue. This is a simple and rational decision that the government can make to treat medical cannabis like every other medication, and especially in light of the lack of insurance coverage, this makes so much sense.
But it is true. If you're looking at equivalency with the pharmaceutical industry in terms of the DIN, there's also a lot of other factors in research and development, et cetera, et cetera. So it's not just as simple as it looks. What's the percentage of medical marijuana used that would have a DIN number now?
It is
very low.
It's an extremely low percentage. The 269,000 Canadians are all using cannabis for medical purposes on the authorization of their healthcare providers, but that's not prescription medical cannabis. There's very few products on the market that are considered prescription cannabis products, and those are only indicated for very narrow conditions. But with that said, let me just remind this committee that the courts have been very clear. In the absence of a DIN, the Government of Canada still has to provide reasonable access to cannabis for medical purposes, and we believe that this is a reasonable approach to treating cannabis like a medicine, and that extends to taxation.
Okay, final question and a short one, Mr. Albus.
Yeah, well, hopefully it'll be short, Mr. Chair. The legislation that we're speaking about here says that products approved by Health Canada with drug identification numbers that are derived from cannabis and can only be acquired with a prescription will be exempt from the excise duty for product offerings. Now, what limits does this place on products that are available that require medical marijuana, as well as you mentioned the 0.3% THC. Now, I'm assuming that this wouldn't be of much assistance to those suffering with chronic pain or illness. Is that the case?
Absolutely. We agree that in the absence of a DIN is not a legitimate reason to tax patients. We're not just talking about HST, GST, which is applied to other products like natural health products that don't have a DIN. I think there's some arguments, not that we would agree with them, that could be made in that regard. But with that said, it's very clear when it comes to excise tax or a sin tax. This should not be applied to medicine. This has nothing to do with the DIN. So while the government is making a good move to exempt these medicines from a DIN, that's only logical. And that same logic should apply to the medical cannabis products that patients are accessing through the ACMPR. And that's where the majority of patients are. That would make a difference in Canadians' lives.